Thank you. That was great. Really great. Thank you. Can we hear it again for Lori? Great job. I do think it's super exciting for us at Manova. We've got Lori, we've got a couple other Walmart members of that team that will be speaking over tonight and tomorrow. You don't want to miss what they have to say. I love programs like the ZP program. You're seeing that, with their focus and with their scale, Walmart can truly have a very positive impact and get us towards that goal of improving the health of every person on this planet. Now, what you're noticing is we're going to move to lunch. As we get further into lunch, we've got after the discussion I'm about to have, you're going to hear directly from Sam Cass as to what you have been eating, and it's part of what he will be talking to you about. But you are about to have an organic meal, very natural, that's right out of the recipe book of Sam Cass. What I want to transition to is I want to bring to the stage someone for a short conversation, and this gentleman's name is Kyle Rolfing. He's one of the founders of Bright Health. And as we were putting Manova together and talking among our community, this was one name that kept coming up time and time again. Kyle is a serial entrepreneur, but he's a little more than that, or a lot more than that. He's like the godfather of all entrepreneurs in this ecosystem of Minnesota, truly. So I want to welcome out Kyle Rolfing there you are, to join me. Good for you. Have a seat. We're going to have a short conversation, and I've been thinking about my questions for Kyle. And so what we have to do is, in Manova, we're talking about the convergence of empowered consumers, technology, new engagement platforms, everything. It seems like a perfect setup for your revolutionizing health plans. So will you start and tell us about Bright Health?
Sure. Well, first of all, godfather of entrepreneur means I'm the old entrepreneur, I think, in the group, but I appreciate that. I've been doing startups for the last 20 years. In fact, the first was a health plan, the first consumer-driven health plan with others in this community, Definity Health. So have been working on this for a couple decades. Bright is unique in that it may be the only health plan I know of that is purely a B2C health plan. We do not work with employers. We work only directly with consumers. And that's important in a number of different ways. One is, when you think about the healthcare system we have in place today, I don't think anyone would say it's perfect. There's a lot broken with it. One of the things we think is possibly broken with it is the employer-based health system. And the reason I say that is you have an entity, and no offense to Walmart or any other employers that invest in this, making decisions on behalf of consumers instead of the consumers right in the center making the decision. What that does is it creates an environment where health plans contract with all the health systems in a market. Those health systems have variation in terms of cost efficiency and quality, but they need access for all their employees. With that model, you have the most efficient health systems effectively subsidizing the least efficient health systems. Everybody in class gets a B, if you look at that as an example. We don't think that's right. The people that lose in that are the health systems that have invested in things like population health and are very efficient. They're not getting the market share gain and all the rest from those investments. And consumers. Consumers are getting this weighted average premium versus much more efficient costs that flow through. So we partner with one health system in a market. We call them care partners. We do that exclusively with them. That is our only network in a market, so to speak. It's an EPO. All of our membership gets all of their care from that health system. And for that, our members get a much more affordable option that's much better coordinated, high quality care. And we think we're creating a win-win-win for consumers that's much needed. Healthcare is not affordable today. A win for the health systems that have done all the right things and made the investments. And we're happy to share in that win as a disruptive model being brought to market.
That's great. So you've got this disruptive consumer model, and I assume I know you have early results. Are you feeling good about where this model can go? And tell us a little bit about that.
Thanks. So we started our first market. We're based here in Minneapolis, first of all, but our first market was Denver, Colorado, with Centura Health System. We came in right out of the gate, got a little less than 12,000 members. Probably most importantly, our satisfaction results were out of this world. Our renewal rates blew away the market.
Oh, good.
But we also were able to get a mid-80s medical loss ratio after risk adjusters year one. That hasn't happened for any carriers in the ACA, both on and off exchange, in any market. So we're thought the market, this model works. We expanded to Birmingham, Alabama, and Phoenix, Arizona. Also added Medicare Advantage, and our results thus far this year, it's not over yet, really replicate what we were able to do in Denver. So we're now going into 12 markets as we speak.
Wow, so 12 markets, congratulations, that's great. I want to shift for a minute because I know I had several people ask me this. Given your sponsorship of so many entrepreneurs, and thank you for doing that for our community, when you look at Minnesota, which has traditionally been a place that sponsored innovation, when you look at our community today, what's missing? And then what are the advantages versus like for entrepreneurs in Nashville or Houston or Boston? What do we have as an advantage? And then what's on your wish list that we do better?
Yeah, I'll start with the advantages. So,
okay.
I always say, and I guess we're proving it out, Minnesota is cold, but it's very hot in terms of the healthcare talent that we're able to tap into in this market. It's really remarkable. And when you think about it, and what we're doing, right, kind of consumerism together with healthcare, you have companies like United Healthcare, you have Medtronic, you have Mayo, you have the health systems that are very strong and very far along in terms of their thinking and innovation, as well as the local health plans here in this market that you can draw from in terms of that talent. More important than just the talent that breeds is that experience. We joke we're the most experienced, i.e. oldest startup on the planet. But having that experience in healthcare with the complexity of healthcare is very, very important. There's a ton of companies in Silicon Valley and others saying, all it takes is technology. I don't know why you make this so complicated. And they usually don't go very far. And so that experience is very important. There's also a petri dish done right. I should mention the Targets and General Mills and Best Buys of the world on the consumer side. And many of those folks kind of go in and out of those companies and get multiple experiences. We've benefited from that. There's also a petri dish because of the forward thinking of those health systems and health plans to try new things for startups that are here that is unlike any other community that you'll find. The wish list, I would say, is primarily on the funding side. I would say in other communities where you have Silicon Valley as an example, Boston as an example, you've had startup companies that, and multiple startup companies that have become very, very large. They become unicorns, multiple unicorns, multiple times over, which has created a lot of wealth in individuals that are entrepreneurs at their core. That's how they made their money. And they've reinvested that in the startup community in the form of angel funding and venture capital funding. We have not benefited from that in this community to date to the extent we need to really propel that forward. There are ways that we can work to address it, but the lack of that funding coming in here, I think, has a material impact.
That's great. So I've heard this before about on the funding side about the people who do fund here have a different kind of time horizon than some of the people on both of the coasts. And I've also heard that from some of the entrepreneurs here that they wish there was more funding available. I know that's something that you advise people on and you help them on. Do you see a role we could play here as we go forward to trying to bring more funders in to kind of see this community and entrepreneurs?
Yeah, I do. I think there's a couple things. One is just making sure we're doing things like this and giving exposure to various entrepreneurs. It's interesting. This community, the Twin Cities, has had over 250 companies started in the last 5 years, and close to $250 million funding that, and that's larger than the greater Chicago area. So it's the largest by far in the Midwest, and people just don't know that. So we need to turn the volume up on that. And then there are things that we can do that take into consideration. We don't have the funding. So how do we mentor better? How do we make access to other resources that aren't necessarily cash to really help prop up the entrepreneurial community?
Good. And I want to ask you one more question before we let you go. I know you're on the board of directors for Medical Alley Association. You're a big supporter, proponent. Talk a bit about how Medical Alley is going to fit into, furthering, building our ecosystem here.
Yeah, it's been remarkable what's happened in the last couple years that I've been involved in, maybe starting a little bit before that. I think Shay's done an awesome job. Before a couple years ago, I would say it was very heavy on the larger company involvement, and then maybe some conferences and social activities for those in the entrepreneurial community. What's happened in the last couple of years is a real recognition of the power of connection that happens across both large companies, a 3M working with a Boston Scientific or Medtronic or whatever it might be. We've seen some of that happen, but also a lot more in terms of entrepreneurs working with those larger companies and how we get that cross-pollination. There's a lot more to come on that. There's initiatives that will be very exciting to this community and have implications actually globally.
Good.
So stay tuned, but there's a movement happening.
Okay, so we're going to make you come back next year to do something, but for sure to talk about that, because that is powerful if we can kind of start to cross-index the major companies with some of the startup stuff. Thank you for everything you do for our community and for talking. And this is a guy that will meet entrepreneurs kind of anytime, anywhere. I probably shouldn't say that because your time's valuable, but stories are told over and over about how he has been very accessible to people that are starting up. So thank you for the role you play in our community. Really appreciate it.
Thank you, Mark.
We'll see you again.
Yeah.
Thank you. So Kyle Rolfing, so he's your guy. He can be a great sponsor, and it's wonderful to have people like that in our community who are, sometimes they don't get talked about, but they're really pushing forward the innovators in our community. So we really appreciate that.